Hi, my name is Richard Stevenson and I'm a dentist, and I have a practice in San Dimas, California, where I also teach courses. Before that, I was a professor at UCLA, which I retired from in 2018 after being there for 26 years. I was the chairman of restorative dentistry at that school for 17 years, and I've had the pleasure of teaching, I think, 26 classes of students at UCLA. So I really enjoyed teaching. And that's one of the reasons why I have a teaching center in San Dimas. And I know Dr. Miller quite well. We've known each other for approximately 20 years, and we work really closely together on cases that are sometimes considered the more complex cases, cases that other people throw their hands up and don't exactly know how to take care of. So it's a pleasure to be associated with the practice, and I'd love to talk to any of you if you have any serious dental issues. I'm sure Dr. Miller will have a consultation with you first, and then the two of us can maybe get to know each other better. We've learned some really exciting things about dental implants the last 5 years. One of them, you have to think about the two parts of dental implants. One part is the way the dental implant interfaces with the body. In other words, its attachment to the bone. And the second part is how do we attach our crowns, our prostheses, right, to the implant. And in both categories, implants have made some really incredible changes in just the last decade or even 5 years. One of the coolest things that implants have done in the last 5 years is they've redesigned the way the threads are made on the implants. That's the area that kind of looks like a screw. Those have been rethought and configured in such a way that they're very stable. Another thing that's happened with implants is the connection to the crowns. So the internal of the implant, in other words, the hole the post goes in where the crown is attached to, that has gone through significant changes. We now have a better system of seal and stability for the crowns on top of the implants. In other words, when the crown is screwed down onto the implant, that connection is more stable. So over time, it doesn't come loose, it doesn't leak, and it provides for a better biological solution. So I think that those are the main two areas that we've seen huge changes in. Also, I guess you could also say that implants can be shorter and yet stronger. When I first started doing implants many, many years ago, implants needed to be 15, 18 millimeters in length. Now we can use implants that are even less than 10 millimeters and have very good stable outcomes. And that's really exciting because that means that we can place implants where we have less bone and still have excellent results. I think that general dentists are currently placing many thousands of implants every year, and they're doing it quite successfully. The key between a formerly trained dentist like a periodontist or someone that's gone through an implant residency program at one of the major institutions, or perhaps an oral surgeon, the difference between that cadre of experts and the general dentist is all about training. So the key here is not that a general dentist can or shouldn't or could do implants, it's that they have the proper adequate training. And adequate training, or let's just not say adequate, let's say excellent training for a general practitioner does not involve taking a weekend course or a week spent in another country placing lots of implants. We have to learn by our mistakes. We have to see what happens after we place implants. So if you can learn how to place implants as a general dentist over an extended period of time, then you're able to better see how things are going. Was your surgery successful? Did that bone graft work? What happens when we have complications? Simply placing the implant actually isn't that hard. What's hard is understanding the entire process from the diagnosis to the long-term results of the case. So I think that if you're going to be a general dentist and going to place implants, and you go through extensive training, and you read, and you even have to take exams and quizzes, and you have to prove yourself, and you have to go through a course that's taught by experts over a greater period of time, then my answer is I think general dentists can be superior to those who just took a weekend course, for example. So I think it's really critical that it boils down to training. Well, I think that, whether you've got a dental assistant, a registered dental assistant, or a registered dental assistant in extended functions, it really doesn't matter. All three of them have to have passion in their approach towards the patient care, in approach towards the techniques, and they have to be willing to learn and take their skills up to the highest level. I think that the best dental assistants for the dental practitioners today are ones that see what we see. In fact, I'd even say are the ones that see what we don't see, so they can alert us to certain situations. In other words, they can be a true team member in the approach of high quality dental care. If the dental assistant is engaged in the procedures, the diagnosis, the delivery of the care from start to finish, and they're able to take care of the patient from a humanistic standpoint, they can be their advocate in the dental office, I think you've got an ideal situation. When a dental assistant does not understand what the dentist is doing or doesn't see what the dentist sees, that sets up a very difficult situation. It can be frustrating for the dentist. The patients can sense this while they're being worked on, quite frankly, and the dental assistants can wonder, why is the doctor not happy with me? So as I was mentioning about dental implantology and learning how to do implants properly, it all boils down to training. So I think in a good modern practice that takes their dental assistant very seriously, they're going to spend a significant amount of time on chairside training and having debriefings after procedures and talk about how to do things at a higher level, talk about how they can work as a true team. Ultimately, you become of one mind. And when the procedures are being completed, you can communicate almost without using any verbal communication. You know what each is doing, and you see things before they happen, and you can actually have each other's back. And I think that provides for the greatest care possible. What does that require? It requires dentists to be humble. It requires dentists to be able to listen and trust dental assistants, and it requires dental assistants to be courageous enough to engage in this integrity with the provider of the care.